folks, think about what we're doing here. Whether you think this is a great idea or this is not a great idea, we haven't had a public hearing on this bill. We haven't had a public hearing even on the concept of this bill. And this bill is here before us. When we walked in the door, our packets had a bill, an initial bill, Senate Bill 1152, that had 9 lines. 9 lines. Today, right now, we have in front of us a document that many of us have not read, many of us don't know all the intricacies of, and that many of our constituents in the hospitals and people that work for hospitals back home don't know how it's going to affect them going forward. And so I don't know whether this is a good idea or not a good idea. It might be. I'm excited about the possibilities that exist from this idea. But to not have a public hearing, to not have a discussion, I mean, as Senator LeBeau said, we got this thing 35 minutes before we started talking about it. And I know how this building works. I get it. We sometimes do that. We come up with things at the last minute and we drop them on our desks and we sort of go along and get along. But when we're talking about hundreds of millions of dollars in bonding and potentially hundreds of millions of dollars in either positive or negative economic impact to the hospitals that we all utilize, some unfortunately more than others, talking about hundreds of millions of dollars in potential impact to these other hospitals, and we're gonna say, yeah, let's move this along. It's a work in progress. How could we do that in good conscience? How can we do that? This might be the best idea in the world, and I hope that it is, because I look forward one day to being able to support this. I really do. I think Connecticut should be a bioscience leader. I think we need to redirect ourselves and rebrand ourselves as a state, because we all know how bad the economic climate has gotten over the years. We need to do something to bring new innovative technologies and new innovative research to Connecticut. But without a public hearing, without hearing, I happened to get an email from the president of Waterbury Hospital late last night saying, oh my God, what are you guys doing? I'm real nervous about this. I happened to get an email from him because he happened to have caught wind of it. How many of your hospital CEOs don't know what we're voting on today? They don't know how it's going to impact them. I bet you a lot of them. I bet you a lot of them have no idea what we're doing here today. No idea how it will impact them. And we're going to vote yes to move it along without a public hearing? We have 3 weeks left to go in this session, folks. 3 weeks left to go. What's the rush? Why do we have to do this right away? Why? I mean, I had somebody do some research for us earlier on how much we've bonded already this year, in this calendar year, versus what we bonded last year. And the rough numbers we came up with were, fiscal year 10, we did about $1.699 billion worth of bonding when you combine our GO bonds and our STO bonds. This year, already, we've bonded $1.927 billion. I have to encourage members to think long and hard before they cast a vote here today. My point with the bonding is that we've been doing a lot more bonding than we have done in the past. And so if that trend continues in the biennium that you're referring to, it's only going to get more. And so, folks, Representative Withers, who I greatly admire, said, you know, this is not, I think, what did you say? It was not step one. Or this is step one. This is step one. Folks, this should be almost the last step in this process. We're the Finance Committee. This should be almost the last step in this process. We haven't even done step one. We haven't even heard from the public at all, other than the sort of occasional rumors that float around the building or the people who might have caught wind of this back home. We haven't heard from anybody. So, you know what? I think Senator LeBeau is 1,000% right. I sit on the Commerce Committee. I'm on the Finance Committee. Let's have a public hearing. Let's slow this process down a little bit. Not to stop the process, but to slow it down and get our arms around what it is that we're voting on. Well, I guess my question then, maybe from a process perspective, is how do we have a public hearing before this gets voted on? How do we hear from the public in a formal setting that is like the process that we normally go through between now and the day that this gets voted on in either of the two chambers?
I don't have an answer for you.
And is there some way that we, as a committee, can schedule this public hearing prior to our adjournment today, I guess is the question.
Not today.
Is that from a process standpoint or from a position standpoint, which I respect, obviously?
Position standpoint.
Okay. Well, thank you, Madam Chair. Folks, I would encourage people to vote against this proposal. I hope that one day in the future, perhaps before the end of the session, perhaps in the next session, that I'm able to support this. But from a process standpoint, this is deplorable. Thank you.